Ouch! That hurts. Ugh, that's sharp. Mm, it's throbbing. Feels like it's attacking my nerves. Those are just a few of the numerous ways in which folks might describe their pain. Do we ever look deeper in how people describe their pain experiences? And how might culture also influence the pain experience? Welcome to People of Color in Psychology, the show that explores mental health topics specific to culture, diversity, and communities of color. I am your host, Jack Sen. Our guest today is Dr. David Cosio, a licensed psychologist who specializes in pain management treatment, has a private practice, and is part of an interdisciplinary pain management program at a large healthcare system. Dr. Cosio is a recognized expert in the field, having presented his research nationally and published multiple articles on patient pain education. In 2017, he achieved the highest level of certification in clinical health psychology from the American Board of Professional Psychology. Dr. Cosio is also the author of Pain Relief, Managing Chronic Pain Through Traditional, Holistic, and Eastern Practices. As a Hispanic psychologist, Dr. Cosio will be discussing holistic pain management in Latinx populations. Dr. Cosio, thank you very much for joining us today.
Thank you for having me. I'm excited to talk about this topic. It's a very important one.
Let's just dive right in here. Can you share with me this idea of holistic pain management treatment for Latinx populations? And maybe tell us a little bit about what that entails and why that is even different, say, from the traditional way of when we think about CBT for chronic pain management.
All right. Well, there's, a couple of things that you want to consider when thinking about pain management. So like one of the things is it's who you're working with. And oftentimes we judge someone by what we see standing in front of us, and we fail to kind of look beyond that, right? So one of the first things that I kind of try to do is kind of take a intersectional approach to chronic pain, meaning that not only am I considering those characteristics that are, in front of you, but also maybe some other ways in which this person differs. And so, race might be or ethnicity might be one of those ways, right? Someone may be Latinx, but maybe they are, identify as female, or maybe they come from a different religion. And those aspects may have a bigger role in that person's identity than what I see in front of me. So instead of kind of looking at a person from what the information that you get from just looking at them, I try to kind of look at them from that intersectional approach. Is what other identities is that person meeting me with, and which one is the most dominant, and how does that dictate, or how does that have a role in their pain management? So that's kind of how I start, right? And then, there are things that you need to consider when working with certain populations, right? So for example, you mentioned Latinx population or the Latino Hispanic population. There's 28 different groups that fall under that category.
Oh, wow. That's quite a bit. I didn't realize. Wow.
Yeah, there's 28. And then, that's similar to maybe the Asian population that's got like 6 different ethnic groups, or a Native American population that's got 574 tribes. And so just because someone fits into a category doesn't mean that there are no differences within that category. I mean, like what I was saying before is I identify as a Hispanic psychologist, and I am bilingual. And when I work with the Latinx, Latin or Hispanic population, there are differences. And there might be slight, even in the language, but there's different customs and different ways of speaking that you have to be familiar with. And if you're not, you have to be open to kind of learning about them and acknowledge how those differences may affect that person's treatment and their assessment.
And so in terms of the identity piece,
Mm-hmm.
and you're thinking about treatment and assessment, just out of curiosity, is there, from your experience, how does that play a role in terms of the pain experience and pain descriptions?
Absolutely. So, again, when speaking about the Latinx population, it depends on, the language. There are words to describe painful experiences that are different than those when you translate them into English, right? There are also, different cultural perspectives or cultural expectations when it comes to pain management. There are cultures that where it is not customary for people to speak about their pain, and so they keep it private or they downplay it, where there are other cultures that maybe it is okay to speak about their pain. In fact, it's part of the language. Words that have to do with pain are used very often. And so yeah, you have to be kind of aware, because there are times when someone's going to come in and they're going to speak with this pain related language that may make you think like they may be in more pain than someone who maybe is not.
Oh, interesting.
And
Can you give me some examples of what that pain related language might be like?
well,
Yeah. Mhm.
in Latin culture, there's something called, ataque de nervios, which means an attack of nerves. If you are taking that word, that language, and you are translating it as it is, it means an attack of nerves. Is that in the nerves related to the nervous system, or is that having to do with anxiety? Is that stress? Right. And so just the language itself can indicate maybe that there's something going on when actually it's something else. Right. So when
Mm.
someone says, I had an ataque de nervios, it is translated as an attack of nerves, but it actually means that the person is having maybe like a panic attack, or maybe
Mm.
that person is having stress or anxiety. Right. So just the language itself can imply a painful experience, and you have to know a little bit about the culture to know that.
Well, I love that example because, well, I remember doing chronic pain research, and I don't think even the words such as attack of the nerves is even conveyed on there. It describes pain interference, like shocking, sharp pain, electrifying, these type of descriptors. And just the idea of when we say attack the nerves, I think, whoa, gosh, how do I even conceptualize that from a pain perspective?
Right. And so, that's an important thing to kind of keep in mind is the language, how it's described, and that's going to, dictate how we assess people, what kind of treatment we're going to offer. The thing is that it doesn't matter the cultural background of the individual. The pain management options are the same. The difference is what that person may choose to kind of pursue. So I take the stance in pain management of letting people know of what is available. Because again, in some cultures, some things are not recognized and some things aren't. So for example, in the African American community, if I were to walk in and talk about hypnosis, sometimes I'm held with some resistance because hypnosis may be against their religious beliefs. It's condemned use in the Bible, or maybe, it's against their cultural beliefs. It's something that doesn't apply to them. And so a lot of the times I have to do education about something that may not be culturally something that people are comfortable with, but is nonetheless an option.
Hmm. Hmm. And what about, say, with the Latinx population? Because I remember working in a large healthcare system, and we were doing, we were taught to do CBT, chronic pain. How
Mhm.
might that differ?
It
Yeah,
depends on.
yeah.
Right. So in
Mhm.
most cases, working in this country, most people speak both English and Spanish, right? And so in most cases, I'm able to use an English translation of CBT. There are times where, certain things aren't understandable. And so you may have to explain a concept or explain something that's CBT related, but in the language that the person is more comfortable in. And there is CBT in Spanish. If you look it up online, you can
Oh,
find that
wow.
there is. Yeah, there are manuals out there. There are things that are starting to come out much more than there were a decade ago, right? Now the question becomes, have those things have they been researched? But that's kind of hard to do when the numbers maybe not as large, right?
Mm-hmm. Yeah, yeah. And so in thinking about this work, this very important work that you're doing, can you tell us, how did you get here? Share with us any memorable events and circumstances that influenced you in doing this type of work?
So it's kind of a couple of roads that led me to this. So when I was in graduate school, I worked with the HIV prevention population. And during that time, that there were a lot of research dollars in that area. There was a need. I felt a connection to the community, and so I wanted to do some work because they're oftentimes very stigmatized and discriminated against. What happened in 2000 is that with the advent of all the new medications that have come out, people are living longer and healthier lives, and so the need became less. And I wanted to find another population where my skill set was still transferable. And so the chronic pain population was found within the HIV population, but also kind of is much larger. It includes a lot more diseases and a lot more chronic conditions. And so I was able to kind of transfer that skill set into the pain management population, and that's working with anyone who has pain. The Latinx population, like I said, I was raised in a bicultural household. My father's family is Spanish, my mother is Cuban, and so there is even a cultural clash there. And learning the language and kind of being able to fit in, both kind of groups. And so I use my language and opportunities to help people who are of the Latinx, Latino, Hispanic population, because those services are often really hard to find. And so I'm able to provide that and because I'm bilingual. And so that's kind of how I've used all my skills to kind of do the work that I do, right?
Yeah, yeah. Wow, it's a coming together based on your experience. Just a combination of your identity, how you were raised. You know,
Mhm.
taking the language, taking the culture and experience, and also just a practical work experience that you had. Now, you mentioned that within the HIV population,
Mhm.
there were the pain issues that were coming up.
Yeah. So within the HIV population, there was oftentimes nerve damage because of medications and things like that. And so they would come in concerns with pain. And so one of the things that we would work with the HIV population was pain management. So it was already a skill that I had already been using, but I kind of expanded to include other people who were not HIV positive, right? And learning how other chronic conditions of chronic pain are dealt with. What's interesting though, and you and I talked about this at one point, was the cultural impact that the choices that we have available from pain management, how there are cultural impacts in what we offer. And so, in the Latin population, you have to know the person, again, not only that they're Latino, but maybe their religious beliefs. And, using traditional healers might be the way of incorporating their culture into the pain management, right? I have an example. It wasn't with a Latino patient that comes to mind, but I had a Native American patient who came in, and the basis of our treatment was to get him reconnected with his tribe. He had somehow become disconnected with them. And so we worked really closely with our chaplain services who knew a chief from his Native American tribe. And we connected them, and he started feeling improvement because he had support within his people. And that's an example of how your culture can be helpful in your pain management, right? There are other cultures that have contributed to pain. So like, a meditation and Ayurvedic diets, they're from India. We know that we use acupuncture and traditional Chinese medicine. Those again have come from the East. And, aromatherapy, those come from, the Egyptians and the Greeks. So there's a lot of different cultures that are affecting the way that we provide pain management also. So it's not one way, it's coming back, right? Those cultures are contributing to what we offer in pain management.
So this is really what you mean by holistic treatment. Just taking
Yes.
all the oh wow, okay, okay. I'm seeing
So
that now.
not only addressing the body, but addressing the mind, right? As a psychologist, I'm there to see if the person is in need of mental health services and addressing, any misconceptions or misinformation or misinterpretations using things like CBT to pain management, because we're looking at the person as a whole.
Mm. Something you also mentioned here, I think, is a recognition that a lot of cultures have actually contributed to pain management treatment.
Yeah.
And
Yeah.
we don't think that. It's for some reason there's a bias that I hold. I acknowledge that, when I think about pain management treatment. I don't think about it from cultures contributing to pain management. At least that's not how we were taught.
Right. Well, in the Western hemisphere, that's not how we're taught, right? But when it comes to pain management, it's really about figuring out what works for that particular individual. And so that has to make us think beyond the boundaries of the Western culture that we work in. And so we reach out to, the Eastern cultures, and to the Latin cultures to see what they do and how they affect, pain. And so from there, we learn that there are people who come from those cultures or have identities in line with those cultures, and may be more open to some of those treatments. Now, there are also people who may be from a majority culture or identify as white, but they also may be willing to do some of these treatments and actually have fruitful experiences because they've tried them.
Mm,
So it's offering this kind of menu that sometimes, like you said, other people don't kind of consider are things that might be helpful for the person.
yeah, yeah, because it's a very Western medical establishment, so it's rarely discussed as an option. Yeah, and so in thinking about your career as a person of color, what were some challenges that you faced and overcame that you would be willing to share?
So, I mentioned before that I come from a bicultural household, right? And I'm a first generation American. And so, one of the first things that I had to kind of identify or kind of identify, it was how I identified, right? What is my cultural identity? And how do I fit in this world that we live in, right? And that's pretty tough for a young kid, as I got older and as I went to college and, went to graduate school and learned about some of these things. I was able to begin to kind of make an amends of how I identified myself. And even to this day, I sometimes am not clear. Depends on where I am in the world is how I identified. So, if I'm in Spain, they may say, "Oh, you're not, you're not Spanish." And if I'm in Cuba, they're like, "You're not Cuban." And if I'm here, they're like, "You're not here either." And so it's finding your place in the world and your identity. And I think that that's important, right? Not only for myself, but also for my work. I also, feel like that allows me to be a little bit more aware and sensitive to other people undergoing similar experiences. And then because of that, I feel like that's why I'm passionate about making sure that people in the Latinx community are getting care. I think that also affects my pain management work because, again, oftentimes it's people who are discriminated or marginalized, right? And maybe not from their cultural experience, but because of their pain and that being part of their identity. And so, yeah, and then I want to make, those things, have really affected the way that I assess and treat everyone,
Mm,
regardless of their culture.
mm, mm. Well, and so, Dr. Cosio, for you, what does it mean to be a Hispanic psychologist?
What does it mean to me to be a Hispanic psychologist? Well, I'm always a psychologist first, and I introduce or I bring in my identity and my cultural identity into my work, partly in doing education, partly in, offering my services to people who may be in need, doing things like this to make people aware that, culture is much more than what we see. There are things that people need to consider beyond what's in front of them. And so, yeah, identifying as a Hispanic psychologist allows me to kind of have that foot in the door to have those discussions and to kind of view the work that I do in that way.
Mm. And how can we support you?
By listening to this podcast, I think that's the first thing. That's a first good step. But identifying that there is much more to people other than what you see. Being aware of all the different types of pain management that are available, including those that maybe we don't think about. And the firsthand, think about some of those Eastern cultures and their contribution to the pain, and Latin American cultures and their contribution to pain. Keeping in mind that sometimes times people aren't going to be open to some of these other differences and these different kinds of treatment, and being okay with that, but also, providing education about how that might be helpful to them. Because sometimes people are, not open to it because they lack the education. And once you give them some information about, why this is helpful, and here's some research to show how it can be helpful, they're more willing to kind of try it. And in my experience, it's often the things that we don't want to do that are the ones that are the most helpful when it comes to pain management. And so why I really like people to be open and try some of the things that maybe they wouldn't otherwise try. And then, for my brothers and sisters in mental health, what I would say is I want them to walk away with the idea that, we can all work more on our cultural, competence, and how we can do that is by, being able to identify ourselves, but also being open to the people that are around us that may be different to us and responding to their needs. And then, not forgetting that one of those populations is the Latinx population.
Yeah. Well, Dr. Cosio, thank you so much for your amazing work and contribution to the field. And also thank you for your time today.
Yeah, no problem. Thank you for inviting me to come and talk on the podcast. I think this is really awesome, and I wish you the best, and that we keep expanding and getting more people to kind of talk about their perspective.
A huge thank you to our listeners. If you enjoyed this episode, please share and subscribe to People of Color in Psychology. You can also support us by registering for continuing education courses or making a one-time donation on the Multicultural Counseling Institute's website. Your feedback is important to us, so feel free to send an email, a message on LinkedIn, or leave a voice message on our website. Until next time, this is your host, Jack Sun.